In 2025, everyone's snack intake was substantially increased. At the beginning of the year, Little X, the Captain Pig, ended the year with a series of shows in various media. I think the most abstract is the difficulty for Americans to obtain antibiotics. Far exceeds that of drugs. In the US, getting antibiotics even involves risking one's life. But as the world's leading drug-producing country, the US, what exactly is the logic that makes antibiotics so hard to obtain in the US? Hello, viewers. Long time no see, everyone. I am the seer from World Watch. Here, on this side of the old China, medications like amoxicillin and sulbactam can be easily acquired, such as drugs like Seclor and oxfloxacin, whether at hospitals or pharmacies. But in the US, this is not the case, because in the US, these are prescription antibiotics. Those without long-term decent jobs can't buy them. Many people, for the first time in the US, experience this situation when going to see a doctor due to persistent fever and sore throat infection. The doctor will first ask if you have a cough. Do you have a runny nose? Have you had any contact history? Then tell you not to use antibiotics, advising you to go home, rest, drink plenty of water, and take fever reducers. At most, they might prescribe antihistamines, making you feel like they're just brushing you off. But the reluctance to prescribe them is not due to the doctor's personal nature, but the US medical system treats antibiotics as so-called high-risk, high-value, highly unpredictable public health resources. To understand this matter, let's first present a commonly overlooked fact. Not in hospitalization. The US CDC points out outpatient antibiotic usage rates are approximately 85% to 95%, and they believe that in these prescriptions, at least 28% are unnecessary. The US CDC has long treated antibiotics as a medication whose usage needs to be controlled, limiting the number of prescriptions. This stems from various legislation that the US has driven since the 1960s. This is from after the 1960s. Various legislations promoted by the US to prevent resistant bacteria. However, this legislation can only make doctors increasingly cautious. So the first barrier to obtaining antibiotics is not the pharmacy, but the doctor's risk function. In the United States, a prescription is not a suggestion, but is written into the electronic medical record and can be repeatedly audited by insurance companies, captured by hospital control systems, and held accountable in medical disputes. Antibiotics are especially sensitive because they involve not only efficacy, but also adherence to guidelines. U.S. pharmaceutical legislation considers antibiotics and other broad-spectrum antimicrobial drugs as high-risk category drugs. Unlike other treatment plans, prescribing such drugs requires additional responsibility if risks arise. That is to say, American doctors, if they prescribe unnecessary antibiotics, causing adverse reactions in patients, resistant infections, or are later deemed to lack clear indications, trouble will fall on the doctor and clinic. Not prescribing will most likely only bring patient dissatisfaction, but will keep the doctor safer. Moreover, antibiotic stewardship implemented in recent years in the United States turns prescribing less appropriately and for shorter durations into quantitative indicators. Even these indicators are written into the evaluations of various medical institutions, insurance reimbursement, and quality programs. The CDC and outpatient antibiotic practices not only provides prescribing trends for different hospitals and outpatient departments, but also uses target exceedance methods to hint at the accountability possibilities for prescription behaviors of different institutions and regions, thereby exerting tangible and intangible pressure. The second barrier for patients to obtain antibiotics is similar to that in China, divided into consultation, registration, diagnosis, prescription, and other steps, prescribing steps, etc. However, there is a charge for the diagnosis. There are many medical centers, public hospitals, and other medical institutions when facing relatively mild conditions. Generally, they also try their best to prevent paying high medical expenses and can, through consultation and medical advice, guide patients to CVS or third-party pharmacies to purchase medicine. There are more non-prescription drug types in the US, covering a large number of therapeutic drugs. Therefore, this method indeed allows patients to save a lot on prescription costs at the hospital. However, antibiotics, as a strictly controlled prescription drug, are not included in this. The CDC system in the US requires that antibiotics prescriptions must be diagnosed first. In many places, mild bacterial infections may be treated as basic common knowledge, and broad-spectrum antimicrobial drugs are directly prescribed. But in the US, to prescribe antibiotics, it is often required to do a swab test first, rapid streptococcal tests, even chest x-rays or blood tests. This is almost entirely because of the practice conducted in the US. Evidence for insurance claims. Combined with antibiotic legislation, insurance companies are more willing to pay for prescriptions with a chain of evidence. The result is that antibiotics, from a cheap drug, change to one that requires upfront payment and entering the diagnostic process before possibly getting access. We can calculate the threshold. More specifically, if you don't have insurance, a visit to urgent care and obtaining the most common out-of-pocket range from the doctor costs approximately between $125 to $300. Many materials give average values around $100 to $200, and only one rapid strep test. According to the range given by comparable price platforms, it can even be as low as $20 to $30, but it is often not sold separately. You still have to pay for a consultation fee first. That is to say, for an antibiotic prescription, ordinary patients need to spend at least $350 to $500. So I just want a box of antibiotics demand is often split in the US into first buy a consultation, then buy a test, and finally be eligible to buy medicine. We don't have to worry about antibiotics, but we gradually exhaust our bodies without realizing it, especially after 25. Life is basically the same. Work pressed during the day, eating is haphazardly dealt with. At night, it's either overtime or having a drink or two. Finally getting home, the mind can't stop and continues browsing the phone until dawn. The burden of eating and drinking prohibitions press on the liver, staying up late wears out the heart. Over time, the belly grows bigger. Fatty liver and alcoholic liver come looking, also frequently feeling flustered and chest tightness. Body overdrawn, exhausted, heart and liver drag down together. Starting now, it's not too late to protect your heart and liver. Recommend it to everyone. Bayer one a day. Heart and liver treasure. One bottle can solve it. Bayer is a 100-year-old pharmaceutical company, like aspirin and Dax, all from their company, this time in the German Chancellor's visit to China, in the luxury business delegation. Bayer is also present. This heart and liver treasure is crafted to pharmaceutical grade, strict standard, and has received Australian TGA certification. Innovatively nurtures the mind and liver. Simply a night owl party, a savior for the socializing party. Core ingredients selected: 30 patented concentrated Naiji herb, water of G-ice, purity up to 80%, like putting a protective suit on the liver. Toxins, resist body damage. Within 8 weeks can see coenzyme Q10, contains 50 milligrams per 2 capsules, just in line with China Drug Administration, daily recommended dosage. Charge up the heart, relieve palpitations and shortness of breath, plus scientifically proportioned ethyl acid. Tin compound vitamins form a heart protection iron triangle, takes care of heart and liver repair, and boosts immunity. Special discounts in the comment section are now online. Counting one bottle down, only 3 yuan per day. And one bottle equals 3. Only need a small 3-digit sum. No longer have to worry about heart and liver health. Heart and liver treasure buyer helps you make up for the overdrawn state. Allows you to strive in career, enjoy life, and also maintain the health system for people with high deductible insurance. This kind of splitting has more dark uses. The meaning of high deductible insurance is within a certain expenditure for medical expenses, needs to be compensated by the patient themselves. This type of insurance is generally low-priced insurance purchased by the poor. Common deductibles are between $1,000 and $3,000, also about $5,000. That is to say, beneficiaries of this kind of insurance, before the deductible is reached, there is no difference from fees. So many people make a choice. Delay until they can get through it themselves. Dragged until the end of the weekend. Dragged until symptoms worsened. Instead ended up in the emergency room because they simply couldn't get antibiotic. But buying a third-party bacteria test can directly tell you have a bacterial infection, then naturally wouldn't do anything. The American healthcare system says verbally to avoid antibiotic abuse. The actual effect is to push some mild patients towards more expensive, later, more passive treatment paths. Think that getting antibiotics, the waiting time before, ultimately, the treatment costs of these patients may still not reach above the deductible, but they have no choice but to pay for the emergency room, instead letting the hospital earn handsomely. The third threshold is yet another legislation. Social level factors. Resistance to widely available antimicrobial drugs. Costs are repeatedly used in the U.S., oppressing with death and scale. The CDC's long-term quoted estimate is over 2.8 million cases of antimicrobial resistant infections occur annually in the U.S. More than 35,000 people die as a result. If adding difficile infections, etc., also considered relevant risks, total infections exceed 3 million. Deaths can reach 48,000, or on the order of 50,000. The CDC repeatedly uses these numbers to lobby legislative bodies to maintain antibiotic-related restrictions, but forgets that such data in front of the entire U.S. population of 300 to 400 million is extremely low and simply not sufficient to tens of millions cannot access antibiotics. Patients comparatively. And the most shameless part is ignoring the lives of tens of millions of people, yet vigorously promoting various opioid drugs. The most typical example is the notorious OxyContin case. The main ingredient of this drug is a highly addictive opioid. In theory, this drug should be strictly controlled, but Purdue Pharma, through marketing, claimed it was less addictive, less than 1%, and obtained kickbacks by bribing doctors. Pharmaceutical companies could even, with the FDA's help, successfully launch this drug within 20 years. Total sales reached $35 billion, but it also resulted in 200,000 American deaths as a tragic consequence. At this time, they didn't mention anything established. From this, low alert abstract situation arose. If American poor want to get antibiotics, then they either need connections or smuggle them through illegal means. However, smart people don't need to resort to smuggling because antibiotics for humans are hard to buy, but antibiotics for livestock and similar animals are plentiful. So many people directly buy fish medicine after fish get sick, the kind that should originally be put into the fish tank, because fish antibiotics are actually similar to those for humans and don't require a prescription. It's just that not everyone knows it. Besides fish medicine, there's also pigeon medicine, Cephalec, azithromycin, amoxicillin, and so on. There are also some fish medicines sold online, designed with human dosage on the packaging. The dose is designed per human use, tablet by tablet. Of course, such audacious people are no longer ordinary illegal groups, must be dealt with severely. Under the lobbying of American pharmaceutical groups, the U.S. government occasionally needs to take strong measures, go out and get rid of a batch. So what the United States says, abuse of antibiotics, causing superbugs and the like, is purely nonsense. They just don't want to give it to people. Antibiotics used for animals have long been overused to an extreme extent. After all, this can also enhance their strength. So here comes the question. Given that antibiotics are so hard to obtain, what if ordinary Americans get sick and are in unbearable pain? Isn't the answer right in front of us? The unbearable pain, huh? Why not just give you some painkillers? If you think these painkillers are like those in China, with 1 or 2 dozen in a museum, with doctors and pharmacy owners emphasizing that you must not overeat them, then you are too naive. In the United States, the range of these painkillers is very wide. Among them, one that is most widely abused is the fentanyl we are familiar with. To what extent is it being abused? In the United States, these drugs can be bought not only in pharmacies, but also in supermarkets, sold in jars of 500 tablets, packed in big cans for sale. There are even family packs of 1,000 tablets, priced at less than $20. So many people are astonished at the scenes. Americans buy painkillers like candy beans when they get sick. The typical example is gout. According to past research and statistics, among the adult population in the United States, the prevalence of gout is about 2 to 4%. This means out of every 100 people, there may be 2 to 4 with gout. Isn't this gout? Aside from drugs like Colchicine tablets for treatment, it's just a stage of gobbling painkillers. Of course, if you think the effect is not good enough, just directly use opioid enhancers. The problem is, in this way, can the human body handle it? Several systems overlap, forming a seamless small sickle trick. Formed a smooth little sickle move. Chain reactions deal explosive damage. This is how execution-level damage is dealt. Because the work of many American low-income people is paid weekly and sometimes even daily. If they can't get the money in time, then when the landlord comes to collect the rent, they will really be evicted. This leads to a kind of business among the US low-income sector called weekend stay. Simply put, on the weekend, if you get sick and can't work to earn money, then you can only borrow money to pay rent. And this interest can be jaw-droppingly high, because studies by the U.S. itself show these loans often accumulate interest upon interest. The average loan amount is $350, with an annual interest rate as high as 391%. So, if you don't want to be kicked out by the landlord, as long as your body can withstand painkillers or stimulants, and you can still go to work, they must get up to do labor. Thus, painkillers or stimulants in America have become a lifeline for many. Isn't it said that antibiotics should not be overused? This thing has long been demonized as politically incorrect. In 2015, the U.S. government announced a 5-year national action plan to slow the emergence rate of antibiotic-resistant superbugs, prevent the spread of drug-resistant infections, strengthen the nationwide detection of superbugs, provide antibiotic resistance data, to hospitals and doctors nationwide, develop better diagnostic tools for superbugs, accelerate the development of new antibiotics, vaccines, and other therapies, strengthen international cooperation, including building a global database on animal antibiotic use, assisting low and middle income countries to deal with the antibiotic resistance crisis, etc. It looks like a plan to safeguard the future safety of human life. However, with doctors' discoveries in practice, most drug-resistant infections are hospital-acquired infections. Most drug-resistant bacteria in ordinary environments cannot compete with ordinary bacteria at all. They can only survive in special hospital environments. And drug resistance doesn't mean the bacteria have a strong survival ability. It just means it has resistance to these few antibiotics. It just shows that it is resistant to these kinds of antibiotics. Most of the so-called superbugs would have perished long ago in ordinary environments. Nothing significant would happen if a superbug escaped from a hospital and swept across the world in a few days. This content of science fiction, the so-called misuse of antibiotics, in many cases is just rhetoric, because bacteria breaking the defenses of human health, or viruses, are indeed powerful, but following them and pouring in are also many pathogenic bacteria. The role of antibiotics is to suppress the latter, relieving the immune system's pressure from tackling pathogenic viruses and bacteria breaking through. Simply put, ordinary viral infections aren't scary. The key is the subsequent bacterial infection. The World Health Organization pointed out in 2022 that 90% of antibiotic-resistant cases actually originate from hospital infections, rather than community drug use. Without antibiotics, relying solely on painkillers or drugs to tough it out would bring humanity's medical system back in line with the 19th century. According to CDC data, during the 10 years from 2010 to 2020, there was a massive decline in outpatient antibiotic prescriptions, with a drop as high as 33%. However, simultaneously, prescriptions for opioid drugs surged by 300%. This data was published in 2021 in the Journal of the American Medical Association. Similarly, statistics from the UK's National Health Service also show a similar trend. Since 2016, antibiotic usage significantly decreased by 40%, but at the same time, prescriptions for potent painkillers, like tramadol, have increased significantly, surging by 200%. So here comes the question. If the US is well aware of this situation, then why tell Americans it's a small matter to die from illness, but a big deal to take antibiotics? Because taking antibiotics is really eating ice. Once the ice is eaten well, then how could I continue to bleed patients? So I'd rather fail to stop killing patients. Also cannot spare a grain of antibiotic for political human rights. Thus, it was sorted out. Actually, the most fatal flaw in this logic lies in the fact that you lose your life. What is the point of talking about the health of all humanity? If you have to die, die gloriously by taking antibiotics, or go die with drugs. And there are plenty of ways to prevent you from taking antibiotics. The US government's control over antibiotics is indeed strict. The FDA had clear regulations long ago. Therefore, doctors do not dare to prescribe antibiotics casually, for fear of prescribing too frequently, being denied reimbursement by insurance companies. Cannot secretly purchase antibiotics either, can only privately seek help from Epstein. At the end of the day, it's the strictness of the US pharmaceutical capital group. Human lives have no profit priority, so it has led to Americans being able to freely buy guns, being able to freely buy drugs, yet not being able to freely buy antibiotics, which is a peculiar phenomenon. After all, the first two are just bottom-tier mutual harm, can be completely ignored, but the latter really harms the interests of the American top class. A heavy-handed approach is necessary. In 2018, California passed the strictest nationwide legislation restricting the use of antibiotics. The bill prohibits routine use of antibiotics for preventing diseases or promoting animal growth. Also prohibits the sale of antibiotic drugs through non-prescription means. In 2019, a U.S. Los Angeles Enforcement Task Force strictly tackled outstanding illegal activities such as selling antibiotics privately, effectively purifying the American social climate, creating a peaceful and stable medical environment, and with a heavy-handed attack through multi-financial coordinated operations, successfully eradicated a hidden professional gang selling antibiotics undercover, arrested a batch on site of people illegally selling antibiotics. In 2022, Ohio exploded with a shocking penalty. 3 doctors were accused of prescribing to healthy people. They issued more than 100,000 pills containing mud, resulting in 41 deaths. Shockingly, every time they issue a prescription, they say for the health of all mankind. How much of it is nonsense, and how much of it is for the profits of the American medical capital group? So all along, the reason why we insist that medical education absolutely cannot be privatized is here. They really can create a conceptual conquest of selling high prices. The antibiotic issue is not a matter of a day or two, but has been for a long time. The collaboration of capital groups. This system works in tandem with phenomenal killing. They directly created a human elimination plan for such anti-human behavior. Everyone must be vigilant. Thank you for watching this episode. That's all the content of this episode. IMC. I hope everyone likes it a lot. Follow Shuodang Zhenghua. It is really important for us. Let's see you in the next video. See you in the next video.